I'm Eric Parker. This morning on CT21, the older you are, the sooner you're eligible. A big announcement this week about when we'll get vaccinated. Many think doing it by age is the right approach, but others who thought they were next in line, they say with good reason they're not pleased. We're learning how and why those decisions were made. And Texas goes dark after a massive failure with that state's power grid. Could what happened there happen here? We're going to find out. Plus, COVID concerns kept him from playing at the Travelers last year, but this year, golfer Chase Koepka is coming back. Will you get to see him play in person? We're looking at plans for the 2021 Travelers Championship and why he's hoping to see you on the course. It's all this Sunday, February 28th, 2021. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker.
Good morning. Thanks for being with us. It was a bit of a surprise on Monday, the governor announcing a new strategy for how Connecticut residents will get vaccinated. It's all based on age. Tomorrow, those 55 and older can start making their appointments. A few weeks later, those 45 and up will get their chance. And by May 3rd, everyone over the age of 16, I should say, will be eligible. Here to talk about how and why that decision was made to use a different route is Connecticut's Chief Operating Officer, Josh Geballe. Josh, thank you for being with us. This was a surprise for many. So how did the Lamont administration come to these figures?
Sure. Well, good morning. As we were doing the planning to get ready for the next phase, as we continue to march very quickly through this vaccination program, it was becoming increasingly clear as we tried to define the fine-grained details around who was going to be eligible as a frontline worker or as a high-risk medical condition. The number of people in Connecticut grew to about 1.1 to 1.5 million adults, which was going to be somewhere in the range of 2/3 of the remaining adults available. So far too many for us to make eligible at once. So we would have had to break that up. And the most logical way to do that would have been by age. Age is most highly correlated with people who've actually been suffering the most severe illness and death. And so then we would have been in a position where we'd go in by age anyway, but we'd have a very complicated process that our providers who are actually doing the vaccinations would have had to manage. And they were telling us that that was going to be a nightmare for them.
Now, the governor said when making this announcement, he said, once you start making exceptions, it gets really complicated. That's what you were just saying. But there is one big exception, and that's educators. Why were they classified out of this instead of the age-based range?
Absolutely. We included educators, teachers, everyone working in the school, the custodial staff, food service workers, bus drivers, and childcare providers because of the children, right? This is in part about making sure we get everybody vaccinated. But we can't ignore the fact that our children have been out of school for a year now, or at least partially impacted. We have a lot of people back since September, but in many cases it's hybrid, a couple of days a week. And some school districts have been remote for almost the whole time. So the amount of how far behind we are in terms of our educational progress and the social and emotional impacts on children as a result of this pandemic are tremendous. And so if we get all of our educators vaccinated here in the next couple of weeks, it gives us the chance to not have teachers have to quarantine when they're exposed and be able to get, full-time 5-day-a-week schooling for several months before we get to the summer. So that's really important. There's an important equity component to that as well in getting our schools open.
Now, moving forward, obviously, there are these milestones that the governor has set by age. The federal government, the CDC, had put out these risk categories. And I want to play you a soundbite from the White House press secretary. She didn't come right out and say she wants Connecticut to change what they're doing, but it didn't sound like she thought it was a great idea either. Take a listen.
There are groups that we feel should be prioritized, whether they're frontline workers, healthcare workers, individuals over a certain age, as you noted. Obviously, governors make different choices about the prioritization and the prioritization order, but we stand by the guidelines we've recommended at a national level.
And obviously, those are guidelines Connecticut has chosen not to follow, setting their own standards. So what do you say to the White House and to other federal officials who are saying, we gave you some things we wanted you to focus on and you've gone a different path?
Yeah, well, listen, we have the utmost respect, obviously, for all of the experts who put so much thought into those recommendations. Of course, they're really focused on the strategy, right? The public health, medical risk. In the states, we're responsible for the execution, right? And as we started to move into the execution and figure out how do we actually do this, listening to our providers, right? The people actually with their sleeves rolled up on the ground doing the vaccine clinics and working through all the complexities of how this was going to play out. Do you require proof? Are we going to ask people to get notes from their doctor and set off a mad scramble of everyone running out to try to get doctor's notes. Or, where do you draw the lines on frontline essential workers? I'll give you one quick example. That CDC group, they included postal service workers, but they didn't include FedEx and UPS drivers doing similar work, literally the people who are actually delivering the vaccine. So it got hard to explain how you justify that. The group continues to grow, and then you get to a point where you really have to prioritize. And again, the most important place to prioritize is on age. That's most correlated across all races and ethnicities with who's most likely to die from COVID.
And I don't want to give the impression that, everybody's against this plan, because we did a poll of our Channel 3 viewers, and obviously it's unscientific, but on the Channel 3 app, they said 75% of them thought the governor had a good plan here. So certainly a lot of people did think so. Obviously the group, and I'm sure the governor saw this coming, was people who thought they were going to be next in line, people who did have one of those comorbidities or other reasons. The grocery workers, for instance, said their union said they were disgusted by the plan. I just want to play a little bit of the reaction that our news crews gathered during the week and just hear what you and the governor say to these folks. Take a listen to this.
My reaction was initially surprise, and I think that's how most of my employees are feeling, just maybe a little let down. It caught them off guard.
They're being told they're essential, but now they're not so essential.
How could you turn your back on people that are sick, that are young? How could you do that?
How are we going to protect the people that are compromised if we're not vaccinating them and pushing them to the back? We're not doing what we need to do.
Now, certainly, Josh, a lot of emotion there from those folks, and I hope you're able to hear what they said. What do you say to them? I'm sure the governor and the folks in his office expected this kind of pushback. What is the message to them?
Yeah, well, listen, we hear the concerns, the frustration, the surprise, and we are so grateful for all of our frontline workers who've been going out there every day for a year now in incredibly challenging conditions, and certainly for the people with those high-risk medical conditions who are younger. We understand the frustration. Listen, almost every day since this pandemic began, the governor has had to make really tough calls on how we respond and how we allocate the scarce resources that we have to try to protect the most people in the state that we possibly can. And he came to the conclusion that this was the way we needed to move. This would help us keep going fast, just as our vaccine supply is really starting to increase. We got Johnson & Johnson coming next week. We're really ramping up. We didn't want to go in a direction that slowed us down and impacted our ability to have equity in how we distribute vaccine. So, I think this is the best path forward for Connecticut, and I appreciate your viewer poll seems to agree.
Just one last question. We're short on time here, Josh, but people see those deadlines. They see the dates when I'm 40, so April 12th will be my date. Can I make an appointment before then? Do I wait for that date? And you just mentioned that Johnson & Johnson vaccine. We expect a lot more of it. Could these dates change, or do we think they're fixed?
Yeah, so the short answer is you have to wait to that date to be able to make an appointment. And then with regards to Johnson & Johnson, you got great news late last week that we're going to get a significant delivery, assuming the EUA approval. Hopefully those dates are now worst case scenarios. And if things continue to move quickly, we keep up the pace we're at, maybe we can even do a little better.
All right. Well, we're definitely getting close to seeing the vaccine available to everyone here in the state. Josh Geballe, the Chief Operating Officer for the state of Connecticut. We appreciate a few minutes, and certainly a lot of people have been talking about this, and we appreciate you taking the time to respond to their concerns.
My pleasure. Thank you.
All right. Still ahead, 4 million customers out of power in a massive electrical grid failure. We covered it all week. It happened in Texas, but could it happen here? We'll find out after this.